Welcome back. We are coming up on another holiday where we're being told to avoid traveling, especially if you're not vaccinated. And there's a new report that finds if you are fully vaccinated and get a breakthrough COVID infection, you are less likely to suffer from long haul syndrome. Joining us to discuss this and much more is Dr. Shikha Jain with UIC. Good morning to you, Dr. Jain. I think let's start with that study because this is breaking overnight. Explain what that study found and what this means and why it's so significant.
So Sylvia, this study came out of Britain, and what it showed was people who were fully vaccinated between January and July, those people who ended up getting the full vaccine regimen, not only were they less likely to get COVID, if they did get COVID, they were less likely to get those long haul COVID symptoms. So one thing that's concerning with COVID is you can either get very ill if you're not vaccinated, or you can get hospitalized, or you can die. But if those things don't happen, you can also develop symptoms that exist within your body and within your life for many, many months. So some people are calling those long haul COVID symptoms. So this study actually showed that if you're vaccinated, the chance of you having those long haul symptoms also drops, along with the chance of you being admitted to the hospital or getting very sick from contracting the virus.
So I'm sure what you would say is another reason to get the vaccine, right? Because this long haul syndrome is something a lot of people have said is just horrible to have to deal with. Okay, I want to talk holiday travel right now and travel in general. We keep hearing about the travel advisory ban. Vermont, the only state that is not on the advisory in Chicago. Is it safe for anyone to travel right now? Because every state is having issues.
You're right. Every state except for Vermont really is having issues. And what I would recommend, if you are not vaccinated, if you can avoid travel, that is probably in your best interest, especially in those states that are having those really high transmission rates. And to be honest, whether you're vaccinated or not, I would not recommend going to states that have those really high numbers like Florida and Texas. And the reason for that is even if you're vaccinated, you can still contract COVID and you can pass it along to other people. So you also need to think about your own risk and who you come into contact with. For example, if you live in a home with young children who haven't been able to get vaccinated yet, or if you interact with people who are immunocompromised, it may not make sense for you to travel. So I'm recommending, whether you're vaccinated or not, try to avoid unnecessary travel. If you're vaccinated or not, when you're traveling, continue to wear a mask, even if those rules aren't necessarily in place in other states, and take extra precautions, such as washing your hands often and masking indoors and outdoors when you're around people and you can't keep that 6 feet distance.
Okay, the CDC just came out with a report saying that at least 180 cases of coronavirus in three states have now been traced to an Illinois church camp for teens and an affiliated men's conference. So kids are going back to school. You know, you think about camp, kids gathering, they had that outbreak there. If kids are getting sick at camp, is it inevitable that they're also going to be at high risk going back to school?
So it's a great question, Sylvia. And last year we saw a lot of schools that were able to stay open in person for these kids, even though we didn't even have vaccines at that point. So I would say that it's possible to keep these schools open. We will likely see cases here and there, but if the schools are really following those strict risk mitigation techniques, so everybody wearing a mask at all times, if they take off the mask to eat, make sure they're really keeping their distance and try to have barriers between them, such as face shield, or some places have put plexiglass, as you can see in that image now. I think it's really important to remember we are going to see COVID cases as kids go back to school, especially because kids under 12 are not able to get vaccinated yet. But if the schools are able to really put those strict risk mitigation strategies in place, bubble the classes, make sure the class quarantines if there is a positive case, then we can keep our kids in school. We just have to follow the rules. And we also have to remember when we're at home, we need to be following the rules. Wearing your mask indoors, not interacting with people who are not vaccinated, especially if they might have symptoms, and really taking those extra precautions so that we can keep our kids in school.
Well, you know, the cold season's coming up too and the flu. Do you suggest that parents have those at-home testing kits just in case their children get sick? I know a lot of them are going to be very concerned about any little sniffle that may come up. So what's your suggestion for that?
So if you're able to get at-home tests, I would highly recommend having 1 or 2 boxes of the at-home test at home, just in case somebody does come down with cold-like symptoms, so you can test them at home. I also want to remind you that the at-home tests are not as accurate as the PCR tests, which take a little bit longer to come back. So if you do an at-home test and you had an exposure, or if you're really concerned, the next step may be that you need to go to an urgent care and get that more accurate PCR test. But I would recommend, if you get symptoms or if your kids get symptoms, if you're able to have those at-home tests at hand, to take one of those tests just to confirm and make sure that you're not carrying the COVID virus in your system. But again, if you're high risk or your high suspicion that you have COVID, even if the test comes back negative at home, try to get to an urgent care where you can get that more specific PCR test, and make sure you're quarantining during that time so you don't potentially expose other people as well.
And the Delta variant surge is beginning to slow in some parts of the U.S., but obviously still high. I'm curious, how is Illinois doing in comparison to other states? And do you expect that this is a cycle that we're going to be seeing a dip anytime soon?
Well, Illinois was doing really great about 2 months ago. Our cases were in the low hundreds. Now we're averaging over 4,000 cases a day, over a 7-day period. So the real concern right now is our numbers have gone up significantly. Our vaccination rates are going up as well, so that's encouraging. But we know Delta is very contagious. You know, there's a lot of questions that get asked about when are we going to reach this herd immunity. The problem is, I think we didn't do enough early on. We didn't get enough people vaccinated across the country fast enough early on to kind of put up these walls and prevent the virus from spreading. And so now we're dealing with these more contagious variants. So Illinois is doing okay, but we still really need to push for a lot of people to be getting vaccinated. And again, we need to make sure that people understand why we're pushing for people to wear masks in schools. I'm still hearing people not understanding why kids need to be wearing masks. It's because COVID is very transmissible. As you mentioned with that church event that happened, I bet there's more than 180 people who are probably testing positive. If you test positive at home, no one knows. It doesn't get reported anywhere. There's probably people who are having very mild symptoms who aren't even getting tested. So there's probably even a higher number of COVID in our community than we know right now. So it's really important for everybody to be wearing their mask and taking those extra precautions and getting vaccinated as soon as they can.
Okay, Dr. Shikha Jain with UIC, thanks so much for joining me. Always a pleasure. Have a great day.